You know what the Lynn Institute brings into working with the vulnerable populations in Northeast Oklahoma City are three things, I would say: facts, long-term commitment, and resources. Now with the facts, they assess the areas of need in the community because their research arm has verified the economic state and the high-risk health conditions of many of my neighbors. And then they have made a multiple-year commitment to find solutions to those factors that cause these conditions and help people get through them and hopefully out of them. And finally, resources. Once the Lynn Institute commits to addressing a particular need, they will find those resources somehow, and they work with the people inside the community to get those resources to those who need them.
Just the relationships that we have together can bring about the collaboration and the change that our community needs to get better. I mean, we knew that we were unhealthy, but we didn't know to the magnitude until the research was done. And now, so that puts it in perspective for us, and so that's helped us to focus on what is going on in our community, and so that the people can get better.
We have been a part of the Northeast Oklahoma City community for about 5 or 6 years. We wanted to see if, first of all, if the residents thought that a farmer's market located in Northeast Oklahoma City was something they wanted, and if so, if they would come to our facility there on Northeast 63rd Street. So we work with Lynn Institute, and they were very generous in providing their services. We were very professional in the research that they did, and they provided us with the feasibility study, which was very positive. So therefore, we're going to be able to open up a farmer's market in the spring of 2022.
Lynn Institute has not only done the research, but also they've done a lot of work with other agencies in the community to find out what the needs are.
The partnership between Lynn Institute and our church has been a great blessing for our community, opening doors that never would have been opened for us to serve that community.
When I joined the collaborative, I could see the true commitment of everybody at every luncheon. It's all about the team, it's all about the mission. I feel like whatever I say, I'm going to be heard.
The collaborative is just a great network of people in Northeast Oklahoma City and Oklahoma City in general that we can connect with and be able to better serve our students and families.
And it was important to me because I've lived Northeast Oklahoma City my whole life, and I've watched it change. I wanted to be a part in making sure that it was always there and available for my children and grandchildren.
A lot of times people come and they do what they want to do, whatever their agenda is, and then they disappear. But the Lynn Institute has been a foundational piece in helping us reach our community, and so we're very grateful for that.
We've had the pleasure of partnering with Lynn Institute, and they approached us to be a part of their On the Road to Health. We provide a registered dietitian that can partner with their employees to be able to provide nutrition consults, and then we also do a lot of food demonstrations, so we really enjoyed that partnership.
I just really feel like the Lynn Institute is such a great way to pull different community groups, so all the resources get to be represented.
So Count Me In for Kids was all about the foster care crisis in our state. And really it was based upon the simple premise that if we had awareness of things that others were doing, and if we had a shared commitment, that all partners, whether it be nonprofits, the private sector, or governmental agencies, could come together and work to find solutions. It's really simple, but it takes somebody to be in a leadership role to pull that together.
I would describe Lynn's work and characterize it as a loving community nonprofit. A nonprofit that just comes to support the community. But we are very excited for Lynn to come alongside us and be able to provide health screenings for our students and families in Northeast Oklahoma City.
I work with Lynn Institute to bring the mobile health screening unit and vision screening into the areas of Oklahoma City. I've been able to see a huge difference in the population that we serve.
I got involved with the food distribution because I felt like I could be a part of making things better. I was especially glad that the food is always healthy food.
When the Lynn Institute says, hey, we're going into an area that we know is underserved, we want to make sure that the same resources that are available to people that can afford it, that do have representation, we want to match that into those areas. And to me, that's the biggest draw.
I didn't know anything about Lynn until a friend from church told me. And so here were some good, solid facts on how I could better maintain my diabetes and live a healthier, more active life.
I found out about the class through my mother. She said you should try it. And it was really a wonderful experience. And I actually lost some weight from some of the recipes that I used.
There was a togetherness, and we looked forward to that time to share and get ideas. And I love the recipes because there was always something new.
I felt like it was my little family away from my family. Not that I ever get tired of my family. And I'm learning some things about how to control some things in my life and that I have control. I would like to see more expansion and growth of the program.
I'm very thankful for the way in which Lynn Institute has approached everything I've seen them involved in. They've asked for people that live that life to have some input, if not lead the initiative to help be a part of the change.
Our church has some land that was actually sitting dormant, and with the Lynn Institute, we're going to be having a pocket park.
This pocket park is going to serve to bring families and the community together. It'll be a place that has a stage. It'll have gardens for their people to even pick freely. It'll just be a place where people can come that's clean and beautiful and neat and slow down and just build family and community relationships. And so we're so excited to be trailblazers with Lynn in making this happen in this community.
When we partner with Lynn Institute, it brings so many resources to the table that then allow for us to have those same connections to be able to do more to service the people in this community. So we really love that.
And they really help us bring hope to our community by providing resources that really our community needs.
I'm excited that they are working on the science of hope. I love it that we're trying to give this to Oklahomans, to all people.
So now that we've learned these things, we can go forward and we can teach others as they're coming to the community center and they're talking about the barriers in their lives. Well, we can help identify those and help them find pathways to reach goals.
This fall, we're going to have a great opportunity to connect with the Lynn Institute to integrate the science of hope into our fall curriculum with our middle school students. So we're really looking forward to that opportunity.
The Center of Social Innovation, we are focused on one thing, and that is mercy and second chances for individuals that are marginalized and individuals that never had the right ecosystems to be the right version of themselves. The Lynn Institute has been a vital piece of our success. We went through a series of workshops. We learned more about what is purpose and hopes and agencies and pathways. As of today, it is a core piece of the Center for Social Innovation's learning objectives. It's weaved into everything we do.
Lynn has really just been on the forefront of everything, trying to make sure that hope is infused in our community in terms of the hope curriculum and training our staff on it, training our mentors on it.
So I'm very excited because OBU is partnering with the Lynn Institute to foster and develop a hope initiative. So we become a hope center at our university for our faculty, employees, students. All of our community becomes centered in hope, to where we become those who can look beyond today to tomorrow and envision a better world together.
Knowledge empowers a person to give them hope, and that hope then generates possibilities.